GOP senators introducing legislation on making mandatory vaccines to travel a thing of the past. One of the leading senators on that is Kentucky Senator Rand Paul. He's joining us live now. Senator, thanks so much for coming on. A lot to talk about here. I know you're bringing new travel mask legislation. I just want to read a quote to catch the viewers up here, and we'll discuss. You say, I am introducing the Travel Mask Mandate Repeal Act of 2021 to put a stop to this nanny state mandate of requiring masks on public transportation. In a free country, people will evaluate their personal risk factors and are smart enough to ultimately make medical decisions like wearing a mask themselves, end quote. Where does this legislation stand now? I know a lot of folks are paying attention to it. They've traveled. They may feel it's unnecessary. How does this legislation work?
You know, it will ultimately be assigned to a committee, and the Democrats are in charge. So far, we've had at least one vote in the Senate, and it came down on party lines. The Republicans voted to repeal the mandate. All the Democrats voted to keep it. I think that there's an authoritarian impulse in the Democrat Party that thinks they know better. Sort of this elitism that people aren't smart enough to make their own decisions, that the government needs to make the decision for you as far as your medical care. But really, if you look at the evidence is pretty strong that airplanes are pretty safe. We didn't have a mask mandate during the first surge, and people continued to fly. And there really were not significant accounts of super spreader events on planes. If you look at the filtration system on the planes, they're 15 times better than your house and about 5 times better than your average hospital. And so the thing is when you look where COVID was spreading during the subsequent waves of COVID, the most common place was in the house. And there was not a lot you can do as far as mandating people's behavior in their house. So I think it's time to let freedom reign again. I think it is important that when we look at this, that the science doesn't show that the masks have done a great deal. In fact, some of the masks, like the cloth masks, don't work at all because the virus is smaller than the particles in your mask. And so really it's a false sense of sort of security, telling people to wear something that doesn't work. And this is one of the lies that continues to be promulgated by Dr. Fauci.
Yeah, you can take your mask down when you're on the plane if you're eating or if you're drinking, this according to flight officials. So there again, you're breathing without that mask around you, and it's not as if everyone has an N95 mask on at that point, which is what you're pointing to. I want to ask you about vaccines. Obviously, a lot of chatter about this. Dr. Fauci supported local vaccine mandates, but former Obama administration Health and Human Services Secretary takes it a step further. I want to play this for you and then get your reaction. Watch.
I think that it's time to say to those folks, it's fine if you don't choose to get vaccinated. You may not come to work. You may not have access to a situation where you're going to put my grandchildren in jeopardy. Freedom is one thing, but freedom when you harm others, like secondhand smoke and issues that we've dealt with very clearly in the past. You can't drive drunk. I want to take off my mask. I want to be able to live my life with vaccination. And right now, I'm being impinged on by people who say, I don't want to get vaccinated.
Now, she likens it to smoking and secondhand smoke, places where you cannot smoke. You can't drive drunk. That is illegal. Does she have a point? What is your response to that?
You know, I think there's a lot of people on the Democrat side who have an authoritarian impulse. They have no concern for individual liberty or freedom. But also her analogy doesn't work. If she's been vaccinated, she's not at risk. She says she's worried about her grandkids who haven't been vaccinated. Her grandkids have a greater risk of being struck by lightning than they do of dying from COVID. The seasonal flu is actually more dangerous for children than COVID is. Now, the reverse is for the elderly. I'm not saying it's not dangerous for the elderly. COVID's quite dangerous for the elderly, but it's not dangerous at all for children. And the thing is that many of the children have had it. These authoritarians like this woman would just soon force your kid to have a shot and a vaccine without knowing whether your child has already had COVID. We need to study whether or not those who have already had COVID, when you give them a vaccine, whether there's a higher incidence of side effects from people who've already had it. We know that if you've already had COVID and then get vaccinated, your response to the vaccine is 1,000 times greater because your body has already been immunized by the disease. So these are questions we should ask. And in a free society, you should be free to decide. It might be that you have an in-between position. You know, your kid's 15 years old and you're thinking about it, but you want to know, well, my kid was sick 2 months ago and everybody seemed to have COVID. Two of his friends had COVID. He seemed to have had it. Why don't I test him for antibodies, and then I'll make my decision whether I want to be vaccinated. But for the school system or for workers to say you can't come to work, even though you've already had the disease and you have just as much immunity as someone who's vaccinated, how unfair is that and how unscientific is it?
That's my point that I wanted to get to with you, because there are millions of Americans that have recovered from COVID-19. They have natural immunity. We're on track with the vaccine distribution. We can cite how many people have been vaccinated, but we never talk about natural immunity. We never talk about the millions of Americans that have gotten COVID. I ask this question all the time, and let me tell you the response I always get is, case in point, we do not know how long the immunity will last. Senator rather, do you know how long the vaccine immunity from the vaccine will last?
That's exactly my response, because reporters in the halls of Congress have been saying this to me for a year and a half now, that I don't know how long my natural immunity will last. And my response to them is, you don't know how long your vaccine immunity will last. Doesn't mean the vaccine's bad or that natural immunity doesn't work. It just means we don't know. But the thing is we've had the studies on natural immunity for longer. The vaccine we've had for about 6 months, but we have people now that have been infected a year and a half out. And all of the studies, including studies from the 2004 SARS, which was another coronavirus, show long-lasting immunity. There are people 17 years later that still have immunity to SARS. All of the studies so far are encouraging that you will have long-lasting immunity. But the thing is, it still gets down to choice. You can look at the studies, you can decide for yourself, but there's ample evidence to say that you do have immunity, and it's not a small amount of people. 34 million people have tested positive, but when you do an antibody survey to see who was positive that never got a test, you find 2 more for every one that tested positive. So that's about 100 million people who had it naturally, and they have immunity. And to discount this is incredibly unfair, to say, oh, you can't come to work or you can't go to school, even though you've already had it. There's no science behind that. It's anti-science, but they don't want to be troubled with it. Everybody's going to be treated like, part of the beehive. It's a collective, and we're not going to think about anybody individually. This is what the authoritarians say. So the new authoritarians are on the left, and there's a bit of irony because they seem to complain all the time about how somehow Donald Trump was going to destroy democracy and bring on authoritarianism, and yet the new authoritarians really seem to be mostly on the left.
Let's talk really quickly before you go about either voter integrity or voter suppression. Depends on what side of this coin you're on. President Biden here calling on Americans to band together to protect the right to vote, reject Republican-led efforts to change election laws. Let's play this for you and I'll get your reaction.
The assault on free and fair elections is just such a threat, literally. I've said it before. We're facing the most significant test of our democracy since the Civil War. That's not hyperbole. Since the Civil War.
That's not the first time that he's used that reference since the Civil War. Your reaction?
He's delusional. The thing is if you look at voting statistics over the last several decades, African Americans actually are now voting at a higher percentage than white Americans in Mississippi and Alabama and most of the southern states, where there was admittedly a real problem in the 30s, 40s, 50s, and 1960s. Now, when you look at statistics, African Americans vote equal to or greater than white voters as a percentage. So that's good news. We should all be, resoundingly cheering because of that news. Instead, he's telling you some kind of dribble that's delusional and untrue. And in trying to feed fear where there doesn't need to be fear, we need to have honest elections, and showing up with your ID has nothing to do with Jim Crow. It was the Democrat Party that needs to apologize for Jim Crow, but it has nothing to do with restricting the right to vote. The Georgia law actually, as well as the Kentucky law, actually extends and expands the ability to vote.
Yeah, a lot of folks, if you read it, it's quite plain literature there, if you will. Before you go, I've got to ask you about this, as you being in the Senate. $3.5 trillion, possibly going to go through reconciliation. Your thoughts on the Senate Democrats continuing to push this so-called infrastructure bill through? Do you think that it gets through? What have you heard?
There is no money in Washington. We bring in about $3.8 trillion a year, but they're wanting to spend about $7.5 trillion. So all of these things are pitched to the public as free money, but you will pay for them. You'll pay for them through higher prices. We're already seeing inflation in the system from the $3 trillion deficit of last year. If we do $3 trillion again this year, that's an enormous, it's more debt than we've ever added in the history of the country. You're going to see rising prices. And so don't be fooled. When the government says, I'm going to give you free stuff, nothing in life is free. You'll pay for it either through the loss of your purchasing power, elevated prices, or you ultimately also will pay for it through higher interest rates and economic stagnation and unemployment. So nothing in life's free. People know this, but we have to resist the allure of the Democrat Party saying, hey, you can have all of this stuff for free. It's not true. It's a bait and switch.
All right, Senator, taking the time this morning here. We appreciate it. Senator Rand Paul joining us live. Thank you very much, sir.
Thank you.